Spiritual care team includes anyone on the care team: physicians, nurses, social workers, child life specialists, psychologists, chaplains, respiratory therapists. Anyone in contact with a patient who is able to see or hear or assess a spiritual need or concern, and then can communicate that need or concern to a spiritual specialist, which may be a chaplain or an outside clergy person, an imam, a rabbi, a priest, a minister. I also think that spiritual care team, in terms of pastoral care or chaplain services, are those who are able to provide support to interfaith populations, regardless of where it is that they come from. Many of us in hospitals really end up coming up against existential issues, and some are described as spiritual and some aren't. So those who don't have a spiritual language or religious language particularly are still rubbing up against the same existential issues that every human being inherently will, particularly in such a vulnerable setting as a hospital. So the spiritual care team is able to assess those issues as they arise and help find resources to allow patients and families to really address them. I also think it's important that the spiritual care team is a care team unto itself. For we as human beings and clinical providers also come up against those existential issues. And being able to provide support to one another as well as our patients and families helps maintain the relationality of human connection within ourselves and also in our interactions with those that we care for.